My name is Fred Hopkins, and this is my axial skeletal bone video. Here we have the frontal bone, the two parietal bones, the occipital bone, the external occipital protuberance is the part right here, and it keeps the head upright in a T shape, and it connects the cranial muscle to the skull. The temporal bone, the temporal mandibular joint is right here. The mastoid process is here. The styloid process is in here. The external acoustic meatus and the squamous part is here. For the internal structures, the petrous part of the temporal bone is right here. This houses the middle inner ear cavity. The internal acoustic meatus is this one right here. And the cranial nerve 7 through 8 passes through here. Sphenoid, we have the superior orbital fissure, which is right here. Cranial nerves that control eye movements 3, 4, and 6 passes through here. This is the lesser wing, the greater wing, and the optic canal. The optic nerves that pass through the eyes, the cranial nerve 2 passes through here. The sella turcica passes through here. The hypophyseal fossa passes through here. For the ethmoid bone, this is the crista galli. The dura attaches here. It secures the brain and cranial cavity. The cribriform plate are these two. The olfactory nerves pass from the smell receptors in the nasal cavity to the brain, passes through here. Next is the sutures. Here is the coronal suture. It connects the parietal bone and the frontal bone. The sagittal suture is connected by the two parietal bones. The lando bones are here. And the squamous suture is right here. Next is the facial bones. This is the maxilla and the alveolar process of their teeth. The nasal bone. The zygomatic process. The squamous and the zygomatic process forms the zygomatic bone. The ethmoid bone is in here. The vomer is a structure in the nasal cavity. What two bones forms the bony nasal septum is the vomer and the perpendicular plate. The inferior nasal concha is the side in the nasal cavity. It moistens the air and cleanses of the debris. The mandible is the body. The mandibular angle is here. The ramus. The mandibular condyle. Here, and a mandibular notch is here. And the coronoid process is right here. Next is the vertebral column, which is this right here. Which two are primary? Primary is a thoracic and the sacral. The secondary is the cervical and the lumbar. Cervical vertebrae, there's 7 total. The atlas is right here, which holds the head up. What does this bone articulate with from the superior, which is the skull? Demonstrate the motion on myself. It allows me to nod yes. What is unique about the transverse process of all their cervical vertebrae compared to those of the thoracic and lumbar vertebrae? It contains a transverse foramen through which vertebral arteries pass through to service the brain. Next is the thoracic vertebrae. There's 12 total. This is the spinous process, the transverse process, the intervertebral foramen. What passes through these foramina is the spinal nerves. This is the body or the centrum and the position of the intervertebral discs. The intervertebral discs are positioned between each thoracic vertebrae in between each body. Next is the lumbar vertebrae. There's 5 total, which is right here. This is the sacrum. There's 5 fused to form this bone. And the coccyx, there's 4 infused bones. Next is the sternum. This is the manubrium, the body of the sternum, the xiphoid process, and the jugular notch. Next are the ribs. Pointing at the vertebrosternal, the true ribs 1 through 7, which are here, up until it connects to the sternum. The false ribs are 8 through 12, and 11 and 12 are floating ribs. Next is the ribs. This is the head of the ribs. This is the neck and the tubercle. Explain how ribs articulate with the vertebrae. They attach posteriorly to the thoracic vertebrae and curve inferiorly towards the anterior body surfaces. This concludes the axoskeletal bone video.